and welcome back to From Living in Silence to Living Out Loud. Before we begin today's episode, I want to thank all of you who have written in and shared your mental health stories, journeys, thoughts, and concerns. Your vulnerability and bravery is something that I continue to be so blown away by. We will be setting up an episode in the near future dedicated to the audience. This episode will include stories, questions, and experts weighing in on what you want to discuss about mental health and wellness. There is still time for you to write in to kset.com and be a part of this incredibly important conversation. I can't wait to personally hear from you. Okay, I will not take up any more time because I could not be more excited and honored to be sitting down with our San Antonio Mayor, Ron Nirenberg, today. He has continued to be a fierce vocal advocate for mental health and wellness in the city. His drive for education, awareness, trainings, and services to our city continues to change the landscape surrounding the conversation of mental health and wellness. I am personally in awe of the work that he has continued to do for our community during and since COVID that has helped really shine a light on the need for accessibility to mental health and wellness advancement and for the conversation surrounding stigma. Today, we will be discussing together how mental health has changed and evolved in San Antonio, as well as understand how we as a community can keep this conversation going. So welcome, Mayor.
Thanks,
I
Talli.
am so happy to have you here.
Great to be here with you. It's good to see you, Talli. It's been a while.
No, it's so good to see you. I wanted to start with a question about how you feel the conversation surrounding mental health has changed over the last 3 years since COVID.
You know, I think the conversation has changed fundamentally about mental health and the fact that we have seen sort of a reduction of the stigma associated with mental health because the traumas that people have been experiencing during the pandemic and you know the challenges, the violence that we've seen over the last few years, just the compounding issues that have really stressed people's lives in so many different ways has really raised a level of awareness and dialogue about the importance and the fragility of mental health and the universality of mental health challenges. And so I think the most important development with regard to mental health, other than what we're doing about it from a programmatic standpoint, is the fact that we are now talking about it more openly than we ever have before.
So do you also think, in terms of the conversation, do you think that there are anything, you know, it's great that everybody's having this conversation and that social media has brought it to a new platform, but do you think in a way we still have some work to do on building the conversation and why we're talking about mental health?
Sure, I absolutely think we do, and I don't think we'll ever reach a point where it's sort of automatic. But I think one of the areas that we still need to work on is just a general understanding of what mental health, mental wellness is. I think people still sort of view it as separate and apart from all other aspects of wellness. I think mental health gets blamed for a lot of things that perhaps are correlated that we need to understand sort of as a comprehensive part of a wellness strategy, community wellness strategy. So I think just generally there needs to be further development of mental health as a part of the overall community wealth, public health, or community health, public health ecosystem that we help support and work towards in our communities.
Absolutely. And, you know, with mental health, it's finally starting to be on the same playing field as physical health.
Right.
What are some things do you think that we could be doing as a community in talking about mental health on the same playing field? And what, do you see as the similarities with physical health? I know that you promote and you have the Mayor's Fitness Council with wellness. So what are some of the things that we could do to sort of bridge that conversation?
Well, I will tell you the Mayor's Fitness Council, which began many years ago, predates me. We about 4 years ago, before the pandemic began, really started to bring in mental health conversations as part of the overall strategy and focus, the mission of the Mayor's Fitness Council. And I think that was telling because, again, we need to think about these mental health and physical health sort of as an overall system of well-being. And if we have mental health challenges, many times they manifest themselves as physical health challenges, and so they need to be seen as equally important. With regard to what we can do, I think to further stimulate the conversation is number one, focus on reducing stigma. We still see people, being shy about or frankly being ashamed of talking about mental health challenges, and people need to be aware, number one, they aren't alone. If you're experiencing stress, mental health challenges, if you have a diagnosis, you are certainly not alone. In fact, you are with the majority of Americans and the majority of residents of the globe. So it needs to we have to continue to reduce the stigma. The other thing I would say is that if you are experiencing challenges, there are resources and ways to help. And some of them require more intervention than others, but people need to feel like a mental health issue is not a dead-end road. We can work towards wellness together as a community. You can work towards it as an individual. You can work together within a community, a family.
Yeah. So one of the things I want to do is kind of bring this conversation back to you, because as I said, I'm in awe of you and the work that you did during COVID, and that every day you showed up for the community. But a question right now for you personally is, how did you keep up with your health and wellness? Because am I asking something a little bit too much?
No, it's an important question, and one, frankly, that I don't think many of us consider, and that's one of the challenges for all of us, and anyone who's certainly in a position where they're working constantly and have to kind of deal with the intensity that we've seen. So, number one, it is still a question that I'm starting to ask myself, but I don't think realistically I or anyone out there has really reflected on the last 3 years and really processed it enough. That being said, I have always been of the belief that mental health is something that I need to take care of actively, and I think a lot of people know I have a pretty regimented exercise routine. That's part of the way I deal with it, dealing with stress through a very strict exercise routine. I tried to also eat well. But it's an ongoing basis. People ask me, about how I deal with the stress of helping
being a mayor.
Managing the seventh largest city in the United States. And I will tell you, the stress level is very high. But as the stress level of the work day goes up, the intensity level of my exercise routine goes up. That's just the way I kind of manage it, and that's just something, again, from an individual basis, know that there are ways to cope with, process, and deal with the stresses that could lead to mental health challenges. You have to be aware of it, and you have to deal with it in an active way.
Yeah, absolutely. And I think that exercise plays such a large role in helping people with their mental health journey. I'll tell you. Yes, go ahead.
No, and that's not to say exercise is the way to do it for everybody.
No, but I think it is.
It's my method.
Yes.
Meditation works. Some people thrive in therapy sessions. Taking a long walk, just being able to really decompress, and I think from a more active mentally, deal with and process the stresses and the challenges that you're under will help you in terms of maintaining mental wellness.
Absolutely, absolutely. And I think it's everybody's, journey is to find. And so this actually brings me to a point that a lot of people today are using the word self-care in terms of mental health. I'm not a big fan of the buzzwords, and this is definitely a buzzword, but I think when we're looking at mental health and self-care, we're also looking at ourselves and kind of taking our own pulse for how we're feeling throughout a day. Is this something that you do when you're looking at your day? Because you have probably, you're everywhere. You're everywhere and doing everything.
Right.
So
it's not enough. I'll be clear on that. And again, I think the level of intensity has been ratcheted up around the world, and certainly here in the United States over the last 3 years as we've been coping with all of these different global challenges, the pandemic not the least of them. So I don't think we have, and I can speak personally, I don't think I have focused enough on what is necessary for self-care. And it's okay to admit that.
Absolutely.
But I do know that throughout my life, I've tried to maintain areas that provide me some decompression, areas that help me to cope with the level of stress, no matter what it is. Again, exercise, eating well, things like that. So can I do better? Yes. Am I there yet? No. But I don't think I'm without those coping mechanism.
Well, I think that's really wonderful and of you to be honest that in saying like, no, I don't do everything I need to do yet. And people want to see who the real you is and hear about, he's human like the rest of us and how we cope with things. Yeah. So I thank you for sharing that.
I would just say it's also really important to find ways that you can cope with, alleviate stress that are healthful, that aren't hurtful to you. It is very easy to fall into a trap of coping with stress in ways that are not healthy for you. And so that's the other thing that you've got to be focused on, is finding the things that work for you that also aren't, bad, leading to negative effects.
Well, we can talk about that. So since COVID, I think a lot of people, especially because we've all been through something nobody had ever anticipated or ever dreamed that we would ever go through. And so people have different coping mechanisms and different ways of coping. And we've seen a rise in alcohol and drug use. What are some of the things right now in the city that you want to be focused on in the mental health arena and landscape?
Yeah, sure. Well, again, mental health has now been part of our common vocabulary, and I will tell you that even before, when we were in the heart of the pandemic, we were focused on what's gonna happen when we come out of this. How do we build a stronger community? How do we recover in a way that we are more resilient, not just from an infrastructure and economic standpoint, but from a human standpoint? And so mental health has always been a common area of focus as we've led through this pandemic. And so with the community's focus, certainly in the city and the city council, the local government, and now also with the assistance of the federal government leaning into this and the state government, we are now putting resources behind programming to ensure that we have the right programs and initiatives available to help again, alleviate mental health challenges in our community. The American Rescue Plan Act funding has been managed through our city quite well. We've put roughly $26 million of our ARPA funds towards mental health in different categories. One of them is focused on youth mental health. We know that the challenges that young people have experienced over the last few years have been compounded by the fact that they've been isolated from school during that portion of the pandemic. A lot of them have missed important dates like graduations and birthdays and all the things that allow a young person to grow socially. So the challenges experienced by young people have been especially acute. So we have focused programs in that area. Another big area of focus is our senior population. Isolation, social isolation is always a big challenge for us. during pre-pandemic times. It became even more acute during the pandemic, and isolation was that much more of a target issue. So dealing with challenges related to our senior population is another focus. A couple other areas I would mention is homeless in our population that is housing burdened, additional challenges experienced in that community. And we know that if someone loses their home, there's an exponential increase in stressors and also negative effects that they are more likely to experience as a result of that. And then, of course, just collaboration with all of the different entities and departments within our city and different government agencies, making sure that we have the right opportunities for people to engage with our mental health ecosystem once they are in need of services, making it more readily available and allowing us to ensure that there's connectivity between the different departments and agencies that can provide relief.
That's wonderful. So my big question as somebody who spends a lot of time in the mental health field is really understanding when the $26 million is no longer, and we've spent a lot of it, and you have really not just, I will say, Mayor, is that you have not only thought of an incredible plan with this, but also you've put mental health on such a different level for our city. But what happens after that $26 million? Is there a plan for sustainability on some of these programs?
Well, so the American Rescue Plan Act, the $26 million I mentioned there, is sort of short midterm funding. So we are going to go through a period of assessment and really evaluating the programs that we've scaled up through the program. So there's going to be a period of time where we sort of what's the next step as we go through spending those funds. I will tell you, though, that the San Antonio Metropolitan Health Department has a mental health strategy that's in the heart of our focus plan. I forget the name of the strategic plan for the Metro Health Department, but mental health is one of the key pillars of that plan. We are working over the next several fiscal years, and it started really a couple years ago, that we are putting more of the program dollars from our mental health program into our general fund so it can be ongoing and sustaining. I know it's not just about money, but making sure that the resources are there to program those initiatives on an ongoing basis is critically important for us. The other thing I'd say is that, we can talk about dollars. It's, I would just tell you, my instinct tells me it's not enough, because we need the state government and we need the federal government both leaning in at the same level of emphasis as local communities across the country, because this is a whole of government approach. We have heard, especially as we've seen the tragedies of gun violence, particularly in schools, that the state legislature in this session, in which they're already engaged, are going to put a huge emphasis on mental health. We need them to put their money where their mouth is. They have said they're going to double the focus on mental health at the state level. We want to see that come to fruition. That will help us sustain our efforts at the local level. And I would also say that we can't forget that part of building a resilient community post-pandemic and the emphasis on mental health is coming from the federal government. So ensuring that we have public health funding coming through HHS at the federal level to support all of these local programs is going to be very key. But where I don't want to go is just to have people assume that just because we're putting money on there, we're getting results. We've got to make sure that we're focusing on evaluating and improving on the mental health, mental wellness of our community at the same time.
This is so great. We'll be right back. We're going to take a quick break, and then we'll continue and pick up where we left off. Thank you.
News,
weather,
mental health,
true crime,
and all things San Antonio.
KSAT has a podcast for everyone with a local twist.
Find us wherever you get your podcasts.
Be sure to subscribe so you never miss an episode.
Or watch the video versions on our KSAT YouTube page.
Okay, we are back. So I'm going to switch gears again and talk a little bit about something that we discussed in the last episode, but really has been on the minds of a lot of people, and it's mental health in the workplace. and really how the mental health landscape is changing the workplace, and how mental health is playing a much larger piece in the way we work. And since COVID, many of us had worked from home and then are getting back into the workplace. What are some strategies that you're seeing, even in your office, that you're implementing that's different than what had happened before COVID?
I would say it's more about a fundamental shift in understanding the role of mental health in the workplace. Again, akin to understanding mental health on the same plane as physical health. If you had an employee who had a debilitating cough show up to work, you'd probably tell them to go home. Just come back when you're feeling better. Right. The same thing. I mean, people are going through mental stresses. Maybe they had something happen in their personal life. Maybe that there's been compounding traumas that they've experienced in their life, work life, or whatever. People need a break. And so being able to recognize, giving supervisors the competencies and skills to recognize mental health challenges, and encouraging them to treat those challenges no differently than they would a physical health challenge from an employee, giving them the space and giving them the wherewithal, the resources to be able to come back healthy is really important.
Absolutely. And do you think that there should be some more trainings and leadership understanding of mental health and wellness in the workplace?
Most definitely.
Okay.
Most definitely. And the key thing there is that it's easy to identify a physical health challenge. I mean, you can see it.
Always. Yeah.
It's not easy to identify, nor is it easy for someone to acknowledge their own mental health challenge. So I think giving us the skills and competencies to understand what they are, to recognize them when they occur, is really where our focus needs to be from a workplace HR standpoint.
Absolutely. So I'm going to take it a little bit further out in talking a little bit about our schools and mental health. And I know that that's a big part of the strategy, and a part of my focus and love is the work that we do in the schools. First, this is kind of like a two-part question, and one, it's about our teachers and our teachers in the workforce, and helping them and giving them the support that they need in order to work through the mental health crisis we're going through. Yeah. What are some things that you hope to see that the community can do, as well as schools right now in general, to provide support?
Well, I would start by, and I don't mean to be flippant here, but I would start by making sure that teachers are paid what they're worth, which they're not. Teachers have a whole host of stresses related to economic issues because of the fact that for years we've been under-resourcing schools, particularly public schools. So that's number one. The other thing is that our teachers are with our young people all day long. And so unless they are already skilled in the area of mental health, they're going to have challenges identifying it on the part of their students, or helping students work through those issues. So making sure that teachers have some resources, some skills, training available to them to help with mental health challenges on the part of their students is very important. But I can't underemphasize the role that we play as a whole of society to make sure that if we want young people to be well, if we want teachers to be well, then we need to make sure that they are valued from an economic standpoint to the extent that they should be. And that's not currently the case here in Texas or anywhere else in the country.
Yes, and I fully agree, and I think we can talk about the financial implications of mental health if we are not giving and supporting, and what else does that mean? I
mean, it's the same thing with any family. The reason why we have such acute mental health challenges that persist among the homeless community is because they have the basics are not taken care of. They don't have a roof over their heads, and that creates all sorts of challenges. And that's the level of stress economic issues can place on a community, on a group of people that needs to really be addressed from a a societal standpoint and from a federal and state and local government standpoint.
Absolutely. And so now let's talk a little bit about the youth in San Antonio and of course how they've been affected and continue to be affected with what has occurred, the last 3 years. We're talking about isolation, we're talking about trauma, we're talking about missing things like what you had talked about. What are some things and thoughts on what we can be doing right now to support the youth? There's so many incredible programs, but what do you see as the future of what we need to do to be supporting youth and mental health?
Yeah, well, that's a great question, and I can answer that sort of as a mayor, but I can also answer it as a father. And what I can tell you is that the most important thing that I see a young person, especially over the last few years, needs to understand is that they're not alone. Yeah. That the stresses of life, and if you turn on the TV and you see more of the challenges that we're experiencing globally, that they are not alone to face the world. Making sure that there's peer support groups available to them that are healthy and productive, ensuring that we have opportunities to recreate and alleviate stress in healthful ways. To me, those are very key. And then from a youth programming standpoint, again, we've got to make sure that our youth mental health services and capacities are increased to the level that we know they are needed, and that's not close right now. I mean, I told you what we are doing with the ARPA dollars at the local level, but this is going to require state support and federal support as we move forward.
Absolutely. And also, there's a shortage in people who are working in the mental health field.
Right.
What does that look like, and what kind of plans do you think? I don't think that this is actually all over the United States. So are there conversations bigger than what we're having here surrounding mental health and getting people into the behavioral health workspace?
Yeah, there are, and like in a lot of fields, but particularly in healthcare, and in medicine, there is significant need for workforce. And so I can tell you at the local level, when we were working through our workforce development programs, one of the things that we're trying to do is work with those healthcare providers who can scale up those kinds of skills and positions, and we're trying to encourage people into that career path. But I think that there are significant needs, particularly for the younger population with regard to school counselors, and folks who are working directly with young people. The workforce needs are even more acute than for the general population.
Yeah, absolutely. So again, this is a really big piece in getting people into the workforce. But it's really also about community. When we're talking about community and mental health, I think the ARPA dollars are bringing, people together and collaborating. What does collaboration mean to you and to the work that you and the city of San Antonio want to see the nonprofits or the colleges working together to build a program? Yeah.
Well, and I mentioned our SA Forward our SA Forward strategic health plan for mental health, and of that, mental health is a big area of focus. We have a mental health collaborative, and we want to make sure that all the different agencies that are providing services, whether it's CHCS or it's directly through mental health or one of the other nonprofit agencies in town, that we're working together towards common goals. So the first thing I would say is that collectively, as a mental health ecosystem, we have to sort of come to a consensus on what are the main challenges that we're trying to address, what are the focus area populations, and then sort of work from that common level of understanding.
Great. Well, I mean, right now you've answered all these really important questions, but is there anything that you would like to share right now, especially to our listening audience who have really taken the time to talk about their own mental health and wellness? And if you want to share anything or a message of hope even, that would...
Well, so, we started the pandemic, and again, the pandemic is not where all these things began, but the pandemic became a catalyst for better understanding what we needed to do about them. We started the pandemic with this phrase that I continue to repeat as sort of the thing we need to keep in mind, and that is we're all in this together. That is true. It's true from a mental health standpoint. I think the single most powerful thing we can say to each other who are experiencing trauma, and the traumas have been compounded, the single most powerful thing that we can remind each other is that we are not alone. If you're suffering, you don't need to suffer in silence. If you're not okay, it's okay. It's okay to be not okay. The challenges and the stresses that you might feel are burdening you and you can't talk about, just know that you're not alone in feeling those ways. It's important to acknowledge that. And then again, next step, there are resources. There are people, there are resources, programs to help. So again, you're not alone and there is help out there.
That is so wonderful, and what a message to leave us all with. And Mayor, I cannot thank you enough for everything that you're doing for our city, for continuing
Likewise.
to keep mental health in the forefront, and for being so honest and vulnerable and transparent today with this conversation. It means so much to me and to our listening audience. And again, thank you all for joining us. And my name is Talli, and I go through it so you don't have to, and we'll see you next month. Thank you.
Thanks, Talli.
Thank you.